Okay, good day, nurses. Today for this recorded lecture, we are going to discuss your anti-mycobacteria, specifically your anti-tuberculosis drugs. So before that one, we are going to discuss first your mycobacteria. Okay? Pag sinabi kasi nating mycobacteria yan class, these are your, nakalagay dito. Okay, these are your group of, these are your group of bacteria that contains pathogens that cause your tuberculosis and your leprosy. So, ibig sabihin, grupo pa ito ng bacteria pag sinabi nating mycobacteria that contains pathogens that cause your tuberculosis and your leprosy. So, in here, meron po tayong tatlo. We have here, number one, we have your Mycobacterium tuberculosis. We also have here your Mycobacterium leprae. And we also have here your Mycobacterium avium intracellular. Okay, mag-start muna tayo dito sa ating Mycobacterium tuberculosis. And then this agent class, this causes your what? It causes yung tinatawag natin na PTB or your pulmonary tuberculosis. Yan po ang ating etiologic agent or the causative agent of your pulmonary tuberculosis. That is your Mycobacterium tuberculosis. And we all know that your TB, okay, this is actually what? This is the leading cause, okay? This is actually the leading cause of death, no? Lahat ng mga infectious diseases in the world. So, number one po ang ating TB, okay? This is the leading cause of death from infectious diseases in the world. That is your Mycobacterium tuberculosis. However, in here, we also have here your Mycobacterium leprae natin. Ngayon, pagdating sa Mycobacterium leprae, this agent causes your what tinatawag na leprosy natin or yung tinatawag dating ketong. Okay, that is your Mycobacterium leprae. And also, the other term for this disease, this is also referred as your what? This is also referred as your Hansen disease natin. Yan po yung other term ng ating leprosy or yung ketong natin. Wherein, this ketong or yung leprosy natin, it is characterized by what? Nagkakaroon po ng disfiguring, nagkakaroon ng disfiguring skin lesions natin. Yan po yung ketong natin, class. Or in tong ketong natin, di ba, makikita natin to even during the times of Jesus, dun, ng unang panahon. Meron po tayong mga lepers na tinatawag, yung mga may ketong, and pinandidirihan po ito ng karamihan sa kanila before. But then, of course, meron naman na po tayong medication for this one. Okay, so yung mga characteristics ng lesions, tuloy ng ating leprosy, nagkakaroon ka ng mga lesions, parang naaagnas yung ilong mo, okay, natatanggal yung mga kilay mo, mga ganyan. So parang sinasabi nila na meron kang lion face. Okay, that is your ketong. And aside from that one, okay, pwede ka rin magkaroon ng destructive effects in your respiratory tract. Yun po talaga yung ng ating leprosy. Okay, magkakaroon ka ng problem in your respiratory tract natin. Okay, aside from that one, we also have here your Mycobacterium avium intracellular natin. This one, ito po usually, yung ating nakikita po natin tong sakit na to, or agent na to, sa patients na merong AIDS. Okay, or your acquired immune deficiency syndrome, or in other patients who are actually severely immunocompromised. Okay, yung mga patient natin na erase lang natin, immunocompromised. Okay, so actually class, nakikita ka sa pag nagkaroon ka kasi ng AIDS, okay, of course hindi mo na naman agad-agad AIDS, no? If you're going to study about your mga retrovirus natin, of course, nag-start muna yan na nagkaroon ka ng STD, into HIV, hanggang sa mag-develop into AIDS. Hindi po agad-agad yung AIDS. Ngayon, kapag nagkaroon ka kasi ng AIDS class, bumababa masyado yung mismong immune system mo. So, nagiging immunocompromised. Mabilis ka lang kapitan ng mga opportunistic infection natin. Okay, ganun po kasi yung AIDS natin. Ngayon, okay, sabi natin, kapag nagkaroon ka ng tuberculosis during your pag nagkaroon ka na ng AIDS, ang tawag natin sa causative agent na yan, that is your Mycobacterium avium intracellular natin. Ngayon, of course, meron naman po tayong gamot to, to combat this agent, no? This is actually developed, no, as an anti-tuberculosis drug. So, this is actually the most effective, no, against your Mycobacterium avium intracellular. Anong tawag natin doon? That is your tinatawag na Rifampin. Okay, this is your Rifampin natin. Ngayon, ulitin natin ang ating mycobacteria. These are just group of bacteria, okay, that contains your pathogens that causes your tuberculosis and leprosy. Aning tatlong agent na yun? We have your Mycobacterium tuberculosis, we have your Mycobacterium leprae, and your Mycobacterium avium intracellular. So yung MTB natin, this is the causative agent for your pulmonary tuberculosis, and your TB is actually the leading cause, okay, of death from infectious diseases in the world. However, with your Mycobacterium leprae naman po, this is the causative agent of your leprosy or yung ketong na tinatawag natin. Ang other term natin for this one, this is your Hansen's disease. And of course, ano ba yung characteristics pag nagkaroon ka ng ketong? Number 1, nagkakaroon ka ng disfiguring skin lesions. And aside from that one, nagkakaroon ka ng destructive effects in your respiratory tract natin. However, with your Mycobacterium avium intracellular naman natin, nakikita po natin tong agent na to. Okay, this one is the cause of your MAC na tinatawag or your Mycobacterium avium complex na nakikita saan sa mga patient na merong AIDS or your acquired immune deficiency syndrome, and of course, yung mga patient natin na immunocompromised. Ano ang ating medication that is actually the most effective against M. avium intracellular? That is your Rifampin natin. Okay, so alam naman natin this, that your anti-tuberculosis or anti-tubercular agents natin, they are being what? They are used to treat your TB caused by Mycobacterium tuberculosis, no? Yung TB natin, it is actually characterized by what? Necrotizing infection, most commonly affecting your lungs natin. And they are always being used in what? They are always being used in combination. Bakit pinagko-combine po natin yung mga anti-TB drug natin, sir? The reason why your anti-tuberculosis drugs are always used in combination class, para magkaroon to of course tayo ng effect or affectation to your what? Doon sa mismong bacteria natin. Okay, affect the bacteria at various stages. Kasi nakadepende naman yung stages natin or staging natin pagdating sa ano natin, sa TB natin, kung ikaw pa ay nakakahawa, okay, kung nasa latent or active phase ka pa ng ano natin, ng TB natin, para ito ay mabilis ma-transmit, okay? Virus stage, and of course, aside from that one, for us to help, okay, for us to help decrease the emergence of what? Resistant strains natin. Okay, nagkakaroon na ng resistance pagdating sa ating mga anti-TB agents natin. Okay, so it is always being used in combination. Okay, meron tayo dito, of course, we have here your first line treatment for tuberculosis, and of course, we also have here the drugs for multi-drug resistant tuberculosis natin. Mag-start muna tayo with your first line treatment for TB. Of course, number 1, we have your ethambutol. Okay, we have your ethambutol, your isoniazid, your pyrazinamide, your rifabutin, your rifampin, and your rifampin. However, with your drugs for multi-drug resistant TB naman po, ibig sabihin, hindi na po nagiging effective yung ating TB drugs, yung ating mga first line treatments for TB, or they are not already effective against your this agent. Okay, so ano yung mga yon? We have your aminosalicylate, your capreamycin, your cycloserine, and your ethionamide, and of course we have your streptomycin. So most of these are actually antibiotics. Okay, but then ang focus lang po natin is, are the first time treatment of your tuberculosis. So we have here the different anti-tubercular agents natin. Of course, you have your rifampicin, your isoniazid or your INH, your pyrazinamide, your ethambutol, and your streptomycin. So yung spelling po ng ano natin, wait lang. Palitan natin. Yung spelling po ng isoniazid natin, that should be iso lang po. Okay, wait lang. Ayan, ganyan lang dapat. Isoniazid. Okay, so this is your ripes na tinatawag natin. Okay, ito pa yung tinatawag natin na ripes. Para hindi nyo po siya makalimutan. We have your rifampicin, isoniazid or your INH, your pyrazinamide or your PCA, your ethambutol, and then your streptomycin natin. So mag-start muna tayo here with your rifampicin natin. Pag sinabi natin rifampicin, ang kanyang tawag dito, ang kanyang mechanism of action nakalagay dito, it inhibits your DNA dependent in your RNA polymerase, wherein it impairs nai-impair po natin yung mismong synthesis natin or yung RNA synthesis, wherein mahihirapan na po silang mag-replicate. Therefore, yung action na yun, this is considered as what? Bactericidal. Okay, kasi nai-impair na po natin yung mismong synthesis para makapag-replicate yung ating causative agent. Okay? Ang number 1 lang natatandaan natin, class, if your patient is actually taking your rifampicin, always remember this one, that your rifampicin causes what? Hepatotoxicity. Okay, or toxic siya sa ating liver. Therefore, kapag toxic yan sa liver, as a nurse, it's very important for you to always monitor for what? You have to monitor for your LFT na tinatawag. Anong ibig sabihin ng LFT? That is your liver function test natin. Yung mga iba't ibang values for LFT, ano ba yung mga yan? We have your AST and we also have your ALT natin. Prior natin ibibigay yung ating rifampicin. Okay? Kasi in the first place, alam natin na hepatotoxicity ang magiging result kapag nagbigay ka ng ating rifampicin without even tawag dito. Okay, wait lang, class, nag-away yung mga pusa ko. Okay? Without checking first or closely monitoring their liver function test or yung mismong ng liver nila. Okay? And of course, kailangan po natin i-monitor yan na every 2 to 4 weeks. Okay? During their treatment of this anti-tuberculosis agent natin. Okay? So aside from that one, ang kanyang effect ng ating rifampicin, usually nagkakos yan ng tinatawag na reddish orange secretions natin. Ibig sabihin, may it be your mga urine natin, okay, yung mga sweat natin, yung mga tears natin, they can actually nagkakaroon ng discoloration, no, ng ating mga secretions natin in our body. Okay? More in this one, it can actually this is actually normal lang po, no. They are actually harmless naman po yung mga natin. These side effects natin, they are actually harmless. So therefore, kapag harmless yan, what will be your instruction to your patient? Of course, it will still, tawag dito, anxiety to your patients. Pwedeng ma-anxious si patient kapag nagkaroon ng changes or nagkaroon ng discoloration sa kanyang secretions. Therefore, what are you going to do is to instruct the patient that it's actually normal and harmless po na magkaroon ng reddish to orange secretions while taking their rifampicin. Kasi nung bata kami, class, nagkaroon kasi na parang outbreak ng TB sa amin. Wherein, hindi ako nagkaroon ng TB. Ako lang ating hindi nagkaroon ng TB sa mismong kapitbahay namin. Yung mga pinsan ko na bata, they contacted your TB. And then, syempre pag bata yan, pag naglalaro kami, sabi ng pinsan ko, gusto mo makita yung ihi ko. Okay, tinignan ko yung ihi niya, talagang kulay orange siya. Okay, kasi nga, I don't even know na he's taking your rifampicin. Okay, so yung kulay ng ihi niya talaga para siyang concentrated na juice na tang, orange flavor. Ganun po yung kulay ng kanyang urine. Okay, and that is the pinaka-common side effect of your rifampicin. Okay? Let's proceed with your isoniazid or your INH naman po. Your INH, nakalagay dito ang kanyang action. It inhibits your what? Mycolic acid synthesis natin. Wherein, kapag nagkaroon ng inhibition of your mycolic acid synthesis, of course, nagkakaroon po yan ng disruption, no? Okay? Sa kanyang mismong bacterial cell wall synthesis natin. Okay, so lahat natin, bacterial cell wall synthesis or nadi-disrupt po yung mismong natin, cell wall natin, wherein we can consider that as a bactericidal action. That is your mechanism of action of your isoniazid natin. Dito naman tayo sa isoniazid natin, class. We can consider this as your what? Number 1, drug for your TB. And ang kanyang pinaka-common na side effect or adverse effect of your isoniazid is what? Neurotoxicity. Okay? It is actually neurotoxic. Wherein kapag neurotoxic yan, pwedeng si patient magka-develop ng what? Peripheral neuritis. Pwedeng magkaroon ng peripheral neuritis si patient while taking your isoniazid. Wherein, ano ba yung mga characteristics ng ating peripheral neuritis? Of course, kapag ikaw yung nagkakaroon ng what? Tingling and numb sensation. Okay, yun po yung natin tinatawag natin na peripheral neuritis. Therefore, anong magiging action natin or ano magiging medication natin for this one or the drug of choice to combat your peripheral neuritis? Of course, what are you going to give? You're going to give your what? Vitamin B yan. You're going to give your vitamin B6 natin. Ano yung vitamin B6 natin? That is your pyridoxine natin. Okay, that is your isoniazid natin. Ang kanyang pinaka-common na adverse effect or side effect is your neurotoxicity. Pwede kang magkaroon ng peripheral neuritis. Therefore, kapag nagka-develop ka ng peripheral neuritis, you're going to give your patient vitamin B6 or your pyridoxine na tinatawag natin. However, we also have here your pyrazinamide or your PZA. Okay, ang action naman po ng ating pyrazinamide, they usually disrupt your mycobacterium tuberculosis membrane transport natin. Okay, disrupt na po yung mismong membrane transport. Therefore, ang action na yan, it can be a bacteriostatic or also bactericidal. Nakadepende kasi yan sa mismong drug concentration and of course, yung susceptibility ng patient sa mismong causative agent na yan. Okay, that is your pyrazinamide natin. Ngayon, ang tandaan lang natin, pag pyrazinamide, yan ang number one side effect niyan, it causes what? Increased uric acid natin or possible na magkaroon ka ng what? Hyper. Okay, pwede ka magkaroon ng hyperuricemia. So, kapag nagkaroon ka ng hyperuricemia, masyadong mataas ang uric acid serum level in your body. Of course, ibig sabihin nun, pwede ka magkaroon ng problem with what? The renal excretion. Okay? Renal excretion of your uric acid. Therefore, it will result to flare-ups of your gouty arthritis. Okay? Pwede ka magkaroon ng gouty arthritis natin. That is a very common naman na effect ng ating pyrazinamide. Ngayon, as a nurse, what are you going to monitor? Of course, you have to closely monitor yung mismong monitor yung mismong uric acid serum level natin. Okay, and of course, you're also going to assess for possible symptoms of gout natin. Once si patient nagtitake ng pyrazinamide. Okay, next naman tayo here with your ethambutol naman po tayo. Ang ating ethambutol naman po, ang kanyang action, it inhibits the synthesis of one or more metabolites of that agent. Therefore, it changes what? It changes the cell metabolism during your cell division natin. Therefore, ang action na to, we can consider this as what? Bacteriostatic. Okay, ang tandaan natin, ang pinaka-common na effect or side effect or adverse effect of ethambutol, no? It is your optic neuritis class. O your optic neuritis, ibig sabihin, pag nagkaroon ka ng optic neuritis, nagkakaroon ka ng lesions in your what? Optic nerve natin. Okay, or your cranial nerve number 2, nagkakaroon ka ng lesion in your optic nerves as well as your chiasm na tinatawag. Okay, that will result to what? It will result to diminish visual acuity natin. Okay, pag nagkaroon ka ng diminished visual acuity, possible na nagkakaroon ka ng blurring of your vision. Therefore, ang gagawin natin kapag si patient nag-develop ng optic neuritis, you have to perform, of course, you have to perform visual activity natin. Okay, you have to perform visual activity test as well as what? And also your color discrimination na tinatawag. Diba? Ano ba yung ano natin dyan kapag meron kang color bright? Anong tawag natin dun sa test na yun? That is your Ishihara test. Kapag yung visual acuity naman, okay, ang tawag natin sa test na yan, that is your Snellen's chart. Using your Snellen's chart natin. Okay, before and after therapy of your anti-TB agents. Specifically, your ethambutol na tinatawag natin. Ang kanyang pinaka-common na side effect or adverse effect, that is your what? Optic neuritis natin. And then last naman tayo here, we have your streptomycin na tinatawag. Okay, yung streptomycin naman natin class, ang number 1 na tatandaan natin, it is of course actually an antibiotic. Anong classification ng antibiotic? This is considered as what? Aminoglycosides. Okay, these are this is an example of your aminoglycosides natin. Ngayon, pag sinabi kasi natin streptomycin yan class, what are you going to do is to what? Okay, to monitor for possible ototoxicity and nephrotoxicity. Kasi yun naman yung na-discuss natin during the discussion of your aminoglycosides natin. Ngayon, kapag nagkakos yan ng ototoxicity, ano ba yung mga possible na symptoms na pwedeng ma-experience si patient. Kapag ototoxic yun, of course, pwede siya magkaroon ng what? Tinnitus. Pwede siya magkaroon ng vertigo, and of course, also your possible or irreversible hearing loss. Kapag si patient nag-manifest ng mga ganitong symptoms, ibig sabihin nun, your medication, your streptomycin is considered as what? Nagkakaroon na siya, nagkukos na siya ng possible ototoxicity sa ating patient. And of course, your streptomycin also causes what? Nephrotoxicity. Therefore, kapag merong nephrotoxicity ang patient natin, of ano magiging magiging action natin, of course, you have to monitor for their kidney function. Test natin yung mga serum level of their BUN, yung CREA natin. Of course, para ma-determine natin yung extent ng damage sa kidney natin for taking this kind of medication. And aside from that one, of course, you have to monitor also with your what? With your urine output natin, or your INR, your intake and output natin. Okay, so ang instruction natin, kailangan lang yung i-increase yung kanyang oral fluid intake natin. And tandaan natin no class, while using your anti-TB agents kasi class, tawag dito, while using this kind of medication, together with your barrier contraceptives natin, and of course yung mga oral contraceptives natin, hindi siya nagiging effective class. Okay, hindi siya nagiging effective yung mga yung mga contraceptive agents natin, okay, kapag nagtitake ka together with this anti-TB agents. Nadi-decrease niya po kasi yung mismong effectivity ng gamot natin. Okay? And of course, kailangan nating tandaan that anything na i-report ng patient natin, we have to monitor that as well. And of course, kailangan nating i-refer yan sa physician natin. So, that is the end of our discussion. This is the basic concept of your anti-TB agents natin.